Hello, everyone. Hello, ladies and gentlemen. Thank you for tuning in to our online presentation today to discuss regenerative medicine. As you log on, can you please just in the chat area type in where you are tuning in from? I already see some Philadelphias out there. Our office that we're speaking from today is in Philadelphia, the Roxborough, Manayunk neighborhood of Philadelphia. I see Chicago tuning in. I see Richland, Washington tuning in. Long Island, welcome from Long Island. I am originally from New York, a native New Yorker. We had practices in Manhattan. I see Manayunk, Roxborough in Philadelphia. Our office is actually in the Manayunk, Roxborough neighborhood of Philadelphia. Our local branch for the Stem Cell Institute of America is in Roxborough on Ridge Avenue. We're Lyceum Physical Medicine, which I'll talk about in a second. I see another Chicago, Louisville, Kentucky, Miami. Maybe it's nice and warm in Miami. I haven't looked at the weather down there. Doylestown, Pennsylvania. Quite a few folks from New Jersey. So as you begin to log on, there sometimes is a little bit of a delay. So we're just going to have you just type in where you're from. I see another Goochland, Virginia. I used to have a practice in Goochland, Virginia. Maybe that's someone I know. We had a little trouble with our microphones. So if you have a little difficult time with the microphone, just hang in there. And as people continue to log on, Manhattan, New York, I see. Very good. Delaware County. So keep logging on, keep letting us know where you're from. We really appreciate you tuning in today. My name is Dr. Bill Pizzello, and I am the president of Lyceum Physical Medicine in Philadelphia. Our office is an integrated medical office, which means we have traditional medical practitioners and alternative practitioners working under the same roof to help you with your health and wellness needs. We specialize in spine and joint issues, but we also work with folks suffering with allergies. We do a large medical weight loss program that I know a lot of folks that are interested in the regenerative medicine like to kind of piggyback and do some weight loss and nutrition as well. We have recently introduced at Lyceum Physical Medicine a drug and alcohol implant in which we implant a naltrexone pellet, and it kills the cravings for opioids, including heroin and alcohol. The program lasts for a year to 2 years. So it kills the cravings, and it's not just a just say no program. It actually kills the cravings so people can be a little bit more focused on what is important and how to get those accomplished. It has been terrifically amazing. And you know, people get this implant and they have their cravings for drugs and alcohol diminish within the first few hours. So it saves lives, and we're really happy to have that in, especially with the opioid epidemic that we have sweeping the nation now. So as you can see, our office is multifaceted. We have plenty of things happening. Today, we're going to talk about regenerative medicine and how that can help with people suffering with knee issues and maybe facing joint replacement, but also facing other types of surgeries, and maybe people who have just been suffering for a very long time. So as you tune in, we're going to go through this information fairly quickly. I want to be respectful of your time and see that we can get this done. It's going to be a lot of information. So please, if you have a pad and paper, we're going to give you an opportunity in a little bit to submit some questions. If you have questions, you can always contact us at info@lyceum Lyceum, Lyceum, PM.com. I will personally answer any questions that you have about any issues that you have. We will later in the presentation give you a really special offer. And like I said, please just take notes because it will be a lot of information. And I ask you just to just reserve your questions for the end. I know that you can put them in the chat box. I'll answer those as well. And again, last time, only because we do not have a slide, my name is Dr. Pizzello, and I am with Lyceum Physical Medicine in the Philadelphia area, the Manayunk-Roxborough neighborhood, and we are going to talk about regenerative medicine and stem cell. The Stem Cell Institute of America is a nationwide company who we are their Philadelphia partner, and we partner with about 600 offices around the country to gather our research and get this science and technology out to as many people as possible. Today is an opportunity for a new life. It's really a day to be excited because it's a different look at probably an issue you've been having for a long time, because you finally do have a chance to feel better and end the never-ending pain cycle and get your life back. Today is an opportunity to change your life. Like I just mentioned, the Stem Cell Institute of America, 600 offices across the country. We bring regenerative medicine to people just like you. We help them to get out of pain, to regain their health, and to maximize their health for the rest of their lives. It truly is a new science. Stem cells, which we will be talking about today and seeing the effects of stem cells and showing you some terrific examples, really do give new life. They don't just mask symptoms. Stem cells heal the underlying cause of your problem. They get to the root of it and they regenerate it and bring back new life. You know that with the more and more talk about prevention and wellness, that it is just not getting rid of symptoms that fixes things. It's actually preventing things and not just handling a degenerative process. Degenerative medicine, which is very typical in what you see in most offices, basically states this, and this is a crude definition of it. We know that your body will degenerate over time and with age. We know that that degenerative process will cause you to have pain and lack of mobility. Degenerative medicine will patch you up along the way using drugs, possibly surgery, and other types of medications to decrease inflammation like cortisone injections and things like that. But the body will continue to degenerate. After the degenerative process has gotten to the end, then we're left with what? Joint replacement. Exactly. So we're trying to avoid joint replacement. Today we're going to talk about knees and look at pictures of knees, but this relates to spine, this relates to hip, this relates to shoulder, and this relates to any other process that you're dealing with the neuromusculoskeletal issues. The regenerative model sets back the odometer and allows you to actually regenerate the damaged tissue so that you again have more life and you take steps backwards rather than just being left with the same joint and the same issue. This is a knee, an x-ray of a knee. Here you'll see the femur bone at the bottom. This is more of the shin bone. And what we see in a phase 1 of arthritis is we see a thinning of this joint space. Even this side is thin, but compared to this side, it's much larger. In a normal knee, this would have even more of a cushion in here. And this, of course, would match the other side. This is a phase 1 degeneration. The cushion that's normally in this joint space is what? It's cartilage or meniscus in the knee. And so we want that to be nice and thick, and there's also fluid in there. So I know some of you have had Synvisc injections or Euflexa injections or Suparts. That is all hyaluronic acid. That already is a fluid that is inside the knee. But in addition to that, there is cartilage. This is a phase 2 degeneration. This is the second phase and the middle phase of what we'll be talking about today. You can see how the joint space is thinner, and I know that a lot of folks are have been faced with the fact that their doctors told them that they're bone on bone. Even in this situation where it looks like it's bone on bone, the regenerative medicine procedures will help and will allow that area to grow the cartilage back, the bone back, and allow that joint to get fuller and more space to be created. When you, however, move into this phase, which is a phase 3, again, the femur bone, the shin bone here, you see how the femur bone is digging down in and actually causing this here, which is a bone spur, and causing it to change the shape of the bone. Our medical director, Dr. Dennis Boyle, at this stage of the game will more than likely recommend that you have a knee replacement surgery. So it is really important that if you are in a phase 2, that you do not wait so long that you move into a phase 3, decide you finally can't take it anymore, you do not want to do anything having to do with joint replacement, and now you're deciding you want regenerative medicine. In this phase, it's not going to work. And again, at the offer I give you at the end, if you decide to sit down and speak with us, we will go through your x-rays and MRIs and see which phase you're in and let you know if you're at this phase or if you would be a candidate for the regenerative procedures. So a new you, if you could get rid of the problems that probably are causing you to tune in here, would you want to do that? And I'd like you to answer yourself out loud because there are options available to help you do that. And remember, don't think within the medical limitations of what is in a common office, which is painkillers, pain management, cortisone injections, steroid injections, and eventually surgery. You have to look at this as a new model, as a regenerative model. So think regenerative. As I mentioned earlier, symptoms are the worst thing to go by to determine whether you're healthy or sick. This car has been running out of gas long before that service engine light went on. And I don't really know if a gas tank causes a service engine light to go on, but you get the picture. So symptoms are normally the last thing to come in a degenerative process, and usually the first thing that goes away. So another example is heart disease. One of the first symptoms of heart disease is a heart attack. But we know we don't want to wait for the heart attack, and we know that plaquing of the arteries and heart issues have been there long before, regardless if you had symptoms of that or not. So please do not wait. Again, if you think that, I feel okay, it's not so bad, don't let yourself cross down those phases of degeneration only to end up in a situation that you do not have another choice. This, of course, is what we're trying to avoid. This is an example for the knee. This is the same situation for a shoulder, same situation for a hip. And I actually here, we're doing more and more ankles, but I actually, for the first time in 20 years of practice, have heard of people having their complete ankles done and complete ankle regeneration. You don't want to have to deal with that. This is 3 to 6 to 9 months of healing and rehabilitation time. You continue to be in pain. There is no guarantee of a result. There's a high percentage of failures and complications. 50% or more people will need additional surgery on the same knee. The average cost of an uncomplicated case is about $55,000. Usually there's some sort of out-of-pocket expense for that, even though it wouldn't matter to me if my insurance picked it all up. I wouldn't want this. Not to mention your lost time, your lost function, pain, suffering, and I'm sure that you're Googling knee treatments and procedures. Your time just spent worrying about the issues. And look at that lovely scar that for some reason they still haven't figured a way around fixing that scar, making that look a little bit better. So the good news is in come stem cells. Stem cells are unspecialized or undifferentiated cells that have 2 characteristics. One characteristic is that if you follow the arrow to the bottom, they can become any other tissue cell in the body. They can become ligament and tendon. They can become blood cells, cartilage, like that meniscus, bone and muscle. They can become nerve and organs. They can become any other type of cell. They are waiting for their mission. And once they do that, they have a really terrific ability to replicate themselves and get very enthusiastic. So they replicate themselves. We actually put them into the joint. They begin to grow. They replicate themselves, throw out the old tissue, bring in the new tissue, to put it simplistically, and regenerate that joint. So where do we get the stem cells? Most people, when they hear about stem cells, initially their mind goes to embryonic stem cells. When you hear, of any controversy involving stem cells, it is based around the embryonic stem cells. Embryonic stem cells are harvested from fetal tissue, and that is normally what you hear about when you hear about Planned Parenthood and these big controversies around stem cells. Currently, those are illegal in the United States, but you can get them outside of the United States. And I do know folks that we have referred out to different areas in the world to get embryonic stem cells, because they are dealing with autoimmune issues, Parkinson's disease, multiple sclerosis, cerebral palsy. And so, outside of the moral issues, embryonic stem cells are a terrific source of young, vibrant stem cells that can really help to heal people. In our office, we do adult stem cells and we do placental stem cells. Adult stem cells are commonly gotten from bone marrow, adipose tissue, or fat. Most people generally remark that they have enough fat to get those out of there. And you hear about bone marrow transplants. Stem cells have been around in wound healing and things like that. So it's been more than 100 years, so it is not an uncommon area to use stem cells. Another area that we get healing cells are straight from a blood draw. Just like if you were given blood at the Red Cross, we take a blood draw and we spin it in a centrifuge and concentrate the healing properties of the blood. We draw that those healing properties and what they call the Buffy coat, and we re-inject it into the joint, and there's terrific results with that. So one area that you can get stem cells is from yourself, and that is a good source of stem cells. But a better source of stem cells is placental stem cell or amniotic stem cell. I will just generalize it and mention it this way. Placental stem cells, unlike embryonic, are from a healthy mother who has a healthy pregnancy, who has a healthy delivery, who has a healthy baby, and donates the placenta so that they can harvest from the amniotic side of it and the amniotic tissue stem cells. They can harvest them from there. Women in the hospital currently are asked if they would like to donate, keep their umbilical blood, and you can freeze that for up to 25 years to be used at a later date in case someone gets sick or has some sort of process that they might need stem cell. So another area in the hospital during that same procedure of pregnancy, we do harvesting from placenta or amniotic fluid. Here's the difference. The bars that you see to the right from this teenager to 30 and 50 and 80 years old, that represents the amount of stem cells that you have in your body as you begin to age. You see that dramatically going down. So when you use adult stem cells, we have to take into account which decade of life that you're in and how many stem cells that you have. Now we'll look later, but blood and there are other, even in the adipose and the bone marrow, there are other healing properties of blood. So it is still a valuable and valid procedure, but when you can offer this placental or amniotic, you can see the dramatic increase in the potency and the number of stem cells. So you have a much better chance of regeneration using the placental or amniotic option. So one of the reasons that placental stem cells outweigh the adult stem cells is that they are also pluripotent. So pluripotent means that they have the ability to become any other type of cell in the body, while adult stem cells can become most of the cells in the body, but are what they call multipotent, which is not become all cells in the body. 3 different types of stem cells, again, available in the United States are stem cells from bone marrow, stem cells from adipose tissue, and placental stem cells from amniotic tissue. Another place that we get concentrated blood and the healing properties is from blood. So we can take a blood draw, and that procedure is called platelet-rich plasma. It is a very common procedure amongst athletes, and the results are phenomenal with that as well. So if we decide not to do these 3 options of stem cell, there is an option of just platelet-rich plasma, which is very effective. This is an example or picture of bone marrow aspirate, where they're going into the bone and drawing out the bone marrow so that they can harvest the stem cells out of that. This tends to be a little more painful. They're obviously going through bone, and it's a little more of a process. So we try to stick with the placental stem cells when it is indicated, or the platelet-rich plasma if it's an injury that could just require that. This is an adipose harvest. Looks similar to a liposuction. And there's not enough fat that's removed that you notice a difference around the waistline. But a lot of people do ask that. A lot of bruising. It is a little more painful. So again, we're showing you these pictures because the placental stem cell is such a terrific option. A couple of different FDA regulations. So I will wrap up with a quick story about this. Outside of the country, you can take stem cells. You can put them, I'll just say, in a petri dish. You can watch them begin to grow. And once you see that they're growing, you can reintroduce them into the body. In the United States, you cannot do that. You have to actually handle the stem cells and re-inject them same day. So you have to hope that they're going to grow in the body. So most of the time they do, but it is a difference in outside of the country compared to inside of the country. Stem cells here are regulated like a pharmaceutical drug. They're very strict guidelines. We recently had a friend that went to Germany and was going to get an adipose tissue stem cell procedure done and for their hip. That procedure in Germany was a $50,000 procedure. They drew the stem cells out of the adipose tissue or fat tissue. It took a period of time for them to stay there. It was approximately a month. And subsequently, they decided not to do that procedure there. It was not so much the money because they had the means for it, but it was more the time period that it took that they would have had to stay there. So we're a little more restricted in the United States, but that being said, the cost is a little more cost effective as well. Stem cells in and of themselves do not know where to go or what to be. They require other things to help them, to help direct them and to also help them to grow. Cytokines, or cytokinins as people say, it's a protein, and they act as the foreman. It's included in the injection. They act as the foreman. They tell the stem cells where to go, what to be, and how to act. Our injections with the placental stem cells have very high numbers of cytokines. In addition to that, this area that says growth factors below, I simplify that and just let people know that these are also items and growth factors in the body that grow. Just like you put Miracle-Gro on a plant, this will assist the growth of the stem cells and the healing of the body. And all of these things have healing properties in and of themselves. So we're able to supercharge that in a pre-formulated injection. Placental stem cells or amniotic stem cells are very safe. They're collected from human amniotic membrane and fluid. And I'll explain that a little more in a second. Amniotic membrane and fluid have no antigens, and it does not cause rejection. You'll notice that in a bone marrow transplant, you'll always hear, is the person a match, or can you find a match, or am I a match? You do not need to be a match. There are no antigens. This tissue that we receive has been tested before and after. And actually, today I listened to a presentation by the lab that produces these stem cells and harvest them. And they go through an even more of a filtering process than any other company in the country. There's zero chorionic tissue. The chorionic is from the mom's side. The amniotic is from the baby side. There is a layer in a membrane, amniotic membrane, that has to separate the mother's side from the baby side, and that is the area that the stem cells come from. So it is very safe, and again, it is an area that you do not need to have a match. The tissue is collected safely in 8 facilities in the United States. The donors are between the ages of 18 and 35. They're healthy. They have no prior use of medication or other chemical substances, careful history, medical history, social life is checked. Their blood is tested for any type of communicable diseases, and the placenta is obtained from healthy donors. They're concerned with the welfare of others, and they donate that at the time of the birth. There are multiple layers, like I mentioned earlier, of testing. The donated tissue is tested before processing, once again on the final product. The procedures follow FDA guidelines 21 CFR Part 1271 and the American Association of Tissue Banks rules and guidelines, all evaluated by a medical director at the donor site. Is everyone doing okay? I hope you have lots of questions already. We're about to get into some of the exciting things and see some of the exciting changes that occur. So hang in there, and please have your questions ready. I'd love to see lots of questions from everyone. Placental stem cells are safe. They are clean. They're effective. I would add one more bullet point and say that they are natural. This is not a synthetic chemical that you are going to get today and 5 years from now have an attorney on the news, on the commercial, saying, if you were damaged by these procedures or this substance, give us a call. We can get you money, even though that you're hurt. This is a safe, clean, and effective, and I will go as far as say natural procedure. And so there's really nothing left to chance as far as safety. This is not an experiment. Placental stem cells are best. The adipose and the bone marrow are not ideal. They have lower numbers of stem cells. They are only multipotent. They have a low number of cytokines or cytokinins. They're missing some necessary growth factors. The procedure definitely tends to have a little more discomfort involved with it, although we do it. It costs more, and you need multiple injections. Some people are dead set that they want a certain procedure, so that's fine. But the placental stem cells is really easy. It's very comfortable, and the effects are just amazing. So why do you need placental? Placental stem cells have the highest volume of stem cells. They have the highest volume of pluripotent stem cells. They have the highest number of cytokines, which is the formin. They have the highest concentration of growth factors, or as I mentioned, the miracle grow. There's zero chance of rejection. We're avoiding surgery. You're getting out of pain. And it ultimately winds up being the most cost-effective for sure. So let's take a look and see the effects of placental stem cell. And that's what these pictures are of, people that have received placental stem cell. And then these are pre and post. So you can see the joint space like we saw earlier. And most people that come in have seen their films. Some doctors don't even go through their films. When you come into our office, we will actually go through your films and show you your films with you, so that you have an understanding and you understand your options. So even if you choose not to receive the procedure, you will definitely get a clear picture when you come into our office of what your options are. But this is a pretty miraculous result. This is at 16 weeks. And what we're looking at is the joint space here, and then a post film at 16 weeks. Nice thick joint space growing. This knee is definitely a more comfortable knee, and this is probably a phase 2 degeneration. Here's another set to our left looking at the screen. You'll see these were actually only taken at 8 weeks. This was actually a mistake, and these films were taken too soon. But you can see that the joint space here is very thin. The joint space over on the other side is getting thicker only after 8 weeks, which is amazing. And here again, I'll just look at this compartment here on the knee, and I'll look at this compartment here, and you see already after 8 weeks, it is a pretty miraculous result. And of course, no less pain or no pain, and the person is definitely feeling much better. Last film that we'll look at, you can see almost no space here. We've done some measurements on these films, almost no space here on the left knee. And then we move on over here to this side, and you can start to see some daylight through here. Again, in this space is cartilage, there's fluid, and any type of bone changes. All of those things, when they are diminished, are going to cause you to have discomfort and pain. Athletes commonly receive stem cell injections. My slide's a little cut off here, but I think I can get through it without it. Tiger Woods, Peyton Manning, Kobe Bryant is a local Philadelphia favorite since he was from, I'll probably say it wrong since I'm originally a New Yorker, but Marion High School. And so these people, Kobe Bryant used to go to Germany to get the procedure before it was available in the United States. This is a common procedure for athletes to get over injuries. Cristiano Ronaldo is another one that I could put on here. Steph Curry, who's an NBA player, hurt his knee in the playoffs and was able to get stem cell injections and continue on in the finals, although he didn't win. But normally that would have been a bench sitting injury, and these folks are getting these injections done, and they are coming back to play without surgery. Tommy John surgery is another area where people used to commonly get possibly career-ending Tommy John surgery are now getting stem cell injections and avoiding that surgery altogether. And so this procedure now is available a little more commonly in the United States for folks like you and I to receive them. And so imagine if you too can get these procedures done and just close your eyes since you're at home in the privacy of your own home, and close your eyes and think about your morning routine. You wake up, your feet hit the floor, and imagine if you did not have to worry about the discomfort that occurred from hitting the floor and going through your morning routine. Moving to the bathroom, making your coffee maybe in the morning or tea, and think about how you would plan your day around not having to feel that you're watching to make sure you're having a good day as opposed to a bad day. So having a really good day and being able to do whatever you wanted without the worry that you were going to be in pain and be limited. Your friends could call you. You could go out with them. You wouldn't worry about, oh my gosh, am I going to be able to walk around the mall? Am I going to be able to go out and stand at a graduation? Those worries would be gone. You'd have your life back. So your healing starts with a single decision. The most successful action is taken by people who actually decide to change. One of my favorite quotes is, nothing changes if nothing changes. You can sit on the sidelines and continue to do the same thing, or we could move ahead and make a change. If you're thinking that you're going to get a different result and continue to do the same things, you're mistaken. It's not going to change. So you have to make a change and you have to make a step. So you see off to the right there, I put up an offer. That offer is for you to be able to come in, receive a consultation with us, bring in your reports and your x-rays, see what phase of care that you're in, and have an evaluation, see if you're a candidate for the procedure, and come up with a plan to see if that would work for you. And to discuss any of the issues that are involved and answer any of your questions. Again, our office is located in Philadelphia. If you are outside of the Philadelphia area, if you email me or fill out that form, there's a message area at the bottom of the form. You can ask for a recommendation to someone outside of the Philadelphia area or ask questions. So again, we are in the Roxborough-Manayunk area of Philadelphia, and we are taking 10 people only for our consultation. that will fill us up. So please, if you are interested in that, it is a terrific opportunity. And at the end, if you do that consultation, we're going to give you some savings on the procedures if you decide to move forward. So again, like we mentioned in the beginning, you have a couple of options. One is think the same, do the same. Nothing changes if nothing changes, and you're going to get the same results. And eventually you'll have no choice but to get replacement surgery or some other surgical procedure. The other is to regenerate it with stem cells. This, like I mentioned earlier, works for shoulders, it works for back, neck, knees, hips. So any of those types of issues we can discuss in your consultation. The regenerative step that you would take would definitely start your life over again and set you back from the path you went down and put you on a new path. 4 reasons to do stem cells now. They only work if you get them. They do not work in the freezer. And so once we put them in, they begin to grow. The most important thing is that you get to them while you have as little damage as possible. With every day that passes, there's more damage that these stem cells are going to have to conquer. So we do not want to fight an uphill battle. We want to handle you and handle these issues when you have the least damaged tissue as possible. Life is about happiness and living. The happier you will be when you're feeling better. You will not revolve your life around figuring out what you're going to do for your pain issues. There's nothing more important than your health, not your car, not your house, not anything, and it's no longer necessary to have to travel down that same path. So, for tuning in today, we give you a gift, the gift of health. And I want to offer you, again, the opportunity to come in, take us up on the free consultation offer. You will get lots of information. If at the very least it's a second or third or fourth opinion, it is worth it, and you are worth it to at least explore those options. We are local to Philadelphia. Again, my name is Dr. Pizzello. I'm the president of Lyceum Physical Medicine. We're in the Roxborough, Manayunk neighborhood of Philadelphia. And if you are in an area outside of that or another part of the country, we can get you to another one of the Stem Cell Institute of America offices, and I can promise you that I can extend to you the same offer. This offer happens to come with a B12 injection if you would like that. It is terrific for the nerve system. It is terrific for fatigue and tiredness. People love them in our office, and we commonly use them as part of our treatment plans. Your gift outside of the consultation is this. If you decide to move forward with these regenerative procedures, if you receive 1 injection, you will get 10% off. If you decide to do 2 injections, you will get 30% off. That might be 2 knees, or a knee and a shoulder, or a knee and your back. That's a 30% savings. We do not offer this savings in our office. This is an online presentation offer. So this is a pretty deep savings for you. If you decide to get 3 or more injections, which commonly people do, once they see how many things they can take care of, you get a 35% discount. It's pretty terrific. Maybe it's 1 and then 2 knees and a shoulder. We've even had families a person do 2 knees and a wife do a shoulder. So we're open to that. So you get 10% off of 1 injection, 30% off of 2, and 35% off of 3. Please remember and jot down that this offer was available to you, and they will extend that offer to you when you come into the office. I really appreciate that you tuned in today. I hope you found this information valuable. I am willing to help you with any of your healthcare needs. Please fill out the message area in the form. When you click on the offer to the right, I will answer any questions via email. My email address is info@lyceum, lycm.com. And any questions that you have, I will personally get back to you. And again, have a terrific week, and we look forward to seeing you, and good luck with your healthcare needs in the future. We appreciate you.